Pro Group Management. Workers' comp that works for you.
Welcome to Nevada Newsmakers. I'm Randi Thompson, sitting in for Sam Shad, and today I'm talking to Travis Sandefur, who's the new Director of Housing and Homeless Services at Washoe County, coming up on an all-new Nevada Newsmakers.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org. A power line is more than a power line. It's maintaining the bottom line for small businesses. It's keeping the assembly line moving for our workforce. For our brightest minds, it's meeting a deadline. It's on the front line with our heroes. And on the sidelines of the biggest games. It's a direct line to our loved ones. And it's a lifeline for the most vulnerable. There's a lot on the line.
Meet Nevada Health Link, Nevada's official health insurance marketplace. Your link to savings, selection, free assistance, and name brand health insurance, where 90% of enrollees lower the cost of their monthly premium. Everyone deserves access to quality health coverage, no matter your income or family size. Visit NevadaHealthLink.com. A few minutes could save you hundreds of dollars per month.
Nevada Health Link. Our plans are made for your plans.
My whole life has been public service. It's about people. And when we work together instead of yelling at each other, we get things done. We don't always get everything we want, but that's our system of government. Give and take. We don't give up. We keep working. We keep pushing. And when we break ground on Nevada's first children's hospital, when crime rates come down, and when graduation rates improve, that motivates me. That's why I do it.
This is Nevada Newsmakers with host Sam Shad on No Holds Barred Political Forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And we're back on Nevada Newsmakers. I'm Randi Thompson, sitting in for Sam Shad, and I'm talking today to Travis Sandefur, making sure I said that right. You're the new Director of Housing and Homeless Services, overseeing the CARES campus at Washoe County. So welcome.
Thank you so much.
So you just started. So I'm sorry it's your first week and you're already doing a TV interview.
That's all right. Thanks for having me.
But tell me a little bit about your background.
Yeah, for sure. So before I moved to Reno, I was actually the country director for Adventist Health International Zambia. So I got to see vulnerable populations, extreme wealth disparity in that country. And when we moved to Reno, this is my wife's hometown, so we moved to Reno, and we wanted to make sure that we stayed engaged in the community. And so I was looking for different opportunities, and I ended up down on the Record Street Shelter Resource Center. Started passing out mail and helping individuals get connected to resources, and just got in deeper and deeper and started working with Volunteers of America. I joined their staff about 3 years ago, and then stayed with them as their Chief Strategy and Innovation Officer until recently stepping into this role.
Okay, and so this is the role that Pat Cashel had before. Kind of, sort of, right?
Yeah, with Volunteers of America.
With Volunteers of America, okay. But the
yeah.
CARES campus now and running the CARES campus.
Exactly, yep.
Okay, yeah, so I told you I'm on the board of Sky Tavern, and we actually hired Pat away from you guys,
Yeah,
so thank you for letting us have him for a
yeah,
while.
yeah.
Amazing young man, but now he's actually back doing consultancy for the CARES campus.
Yeah, he's back down in town, yeah.
Yeah, which is great. And it does take a passion to do. Where do you find the strength to fight for people that have been kind of left behind?
Yeah, for sure. I just find them to be the most extraordinary people. And I saw that in the mailroom. You come in with your preconceived ideas of what somebody's background might be, but instead you're seeing these extraordinary stories of redemption and hard work. And I saw that overseas too. You see some of the hardest working, smartest individuals who just haven't had the opportunities that some of us have had, and they find themselves in these situations. But it is really the staff. And so the frontline staff at the CARES campus, our place shelters, and our county staff, our case managers, that is the hard, messy work. And they are why I get out of bed every morning just on fire to come and help try to end homelessness.
Oh, God love you for that. I mean, it's just, I can't imagine. I saw this movie recently, I think it was called I Am Stranger. and I think it's an Angel Studios, but it's about all these people that are trying to come to America, and how this doctor, who I think was from Syria, ended up being in a hospital in America, but she was, taking out the trash. And she actually helps at the end diagnose an issue. But it's just a fascinating story of the people that are trying to come to America for a better life. And while that's not necessarily your group, because a lot of the folks you see in the homeless shelter are drug addicts, mental health, whatever that is. But it gave me a real understanding of what people are really trying to do when they strive for a better life. And I think a lot of the people you're dealing with are really striving that, but they've kind of gotten lost in the system, given up, families given up. So what are some of the options you are giving now at the CARES campus to help these people get back on to a life?
Yeah, absolutely. I think one of the coolest things about the CARES campus is that we were trying to bring an integrated care approach. And so you've got to look at the different pathways that somebody comes into homelessness. And a lot of times that's a financial hardship. A lot of times that's a behavioral health issue, the mental illness, the substance abuse. So what is the reason that that particular individual came in, and what are the pathways out? One of a shelter director in California shared this with me. It's like an hourglass. There's all these different pathways into homelessness. You kind of get them bunched up at the shelter, and then there need to be different pathways out. And so we are doing that. And so a few of the things that we have in place there right now, we have case management, which is a person-by-person pathway. It is your own plan of what success is going to look like for you, with housing always being one of those goals. And so on campus right now, we are also starting to integrate. We've got groups, we've got AA, we have NA, we have these different groups that are coming onto the site. We have nursing staff on site to help take care of those physical health needs. And then we're starting some of these work programs to help the population that can learn, again, those life skills and those working skills, getting them back out into the workforce as well.
So one of the reasons I'm doing this interview was I was being told by Commissioner Andriola about the sequential intercept model. I want to get into that a little bit, but a couple of weeks ago I had a meeting. I run a CEO group, and we had a meeting with the sheriff, and he talked about some of these programs that they're doing at the jail. And I was actually surprised, because I think of the jail as just a place you hang out until something happens. He's putting in work training. He's putting in AA meetings, NA meetings. He's helping these people actually get a better life and stop recidivism. And one of my CEO members was in an Uber talking to this young man who was driving the Uber, who talked about how he went through this program at the jail, and it turned his life around. So it's really cool to hear real life examples of these systems working, because we look around the country and it seems like, who's got the answer to homelessness? So can you tell me a little bit about the sequential intercept model and how Washoe County, from what I understand, wants to be innovative in the nation to work on this?
Yeah, so I think the basic premise of the sequential intercept model is, how do we keep from criminalizing mental illness and some of these behavioral health issues, right?
Okay.
And so the idea is, how do we intervene along that pathway as people would interact with the system, whether that system is law enforcement, various crisis interventions, before they get deeper and deeper into that system, so that we can have more success stories like the one that you heard there, versus just the one size fits all. We put that individual in jail and move on. And then what happens when you do that, the one size fits all, you'll watch these individuals, because it wasn't a tailored, we didn't get at the root cause, they're just going to get deeper and deeper and cycle back through.
Wow. All right, we're going to continue this conversation. We're going to take a quick break. We'll be right back after this.
The road to riches leads straight to the Carson Valley Inn. Cash drawings Thursday and Saturdays. Over 480 winners. Score up to $15,000 weekly. Plus one $10,000 cash winner and the $20,000 guaranteed grand prize giveaways. Free meals, free play, and more. Only at the Carson Valley Inn.
We're the Peters family, 2 combat veterans, our daughter Elle, and our Liberty Dogs puppy in training, Cooper.
Cooper will grow up to be a life-changing companion to a veteran with visible or invisible challenges.
We're helping Cooper build focus and confidence so he's ready to support his veteran.
And we know he will help bring happiness and independence to his veteran's life.
So join us, become a puppy raiser, and change lives, one puppy at a time.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year. and allow them to provide much needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
The trucking industry is the most resilient link in the supply chain. And for over 90 years, the Nevada Trucking Association has been the voice for the men and women in the trucking industry. From Carson City to Washington, D.C., we advocate for policies to protect our trucking companies and keep commerce flowing. Because Nevada's and America's prosperity is tied to trucks. There's nothing without trucking.
This is Nevada Newsmakers.
Back on Nevada Newsmakers, I'm Randi Thompson, sitting in for Sam Shad, and I'm talking today to Travis Sandefur, who's the new Housing and Homeless Services Director for Washoe County. So tell me, what is the day-to-day life at CARES Campus?
Yeah, so imagine that you were to find yourself in a situation where you needed to come down to the shelter. We have the Welcome Center, and this is a place where the first interaction is going to be with diversion and intake staff. We want to make sure that if we can keep you out of the system, if we can keep you out of the shelter, that's good for everybody. And so this staff is trained towards interviewing, asking a lot of questions. Hey, maybe you actually have family and a stable housing environment that we could get you back into. Maybe you came from a location that we can get you right back to. So that staff is well trained to make sure, is this the right spot for you? If so, you come in, they do a questionnaire. Data collection is key. We want to understand where you're coming from, why you are here, so that we can better help you find a pathway back out, so that this is a brief stay, if at all possible. That staff will help you find your bed within the shelter, and then you are going to get assigned to a case manager. These are the people that get into the messy work of helping you develop a plan, getting you connected with the right resources. Maybe that is treatment, maybe that is mental health counseling, and then they're working on a housing plan with you. And then one of the things that we've been adding in recent months and even prior is getting those groups that I talked about earlier, but also making sure that there are more and more activities and pathways for you while you're on the campus. And again, like I mentioned earlier, having some opportunities for you to engage with workforce training, life skills development, particularly for those who've been homeless for a long period of time. Some of those simple tasks that are going to be critical when you get back into housing, paying your bills, keeping your unit clean. We want to make sure that you have the right skills coming out of the shelter so that you're ready for that when that time comes.
And then food.
Yeah.
There's no food desert at the CARES campus, I hear.
No, yeah, there is so much food, and Catholic Charities has just been phenomenal in helping to make sure that we provide nutritious meals on that campus. So 3 meals a day. It's phenomenal. They folks will start lining up there early in the morning at 5:30 into the dining hall, and it's just an amazing community hall experience when you go in there. You can certainly volunteer through Catholic Charities to come down and serve food down there as well.
That's very cool. And you can also tour the campus as well, correct?
Absolutely. We have regular tours. If that doesn't work for you, I invite people, make sure you reach out to us. We want to get you through so that you can see what this campus is like and what we're trying to accomplish.
Okay, what's a good phone number if somebody wanted to reach out to you?
I can get that for you
we'll
after, and we can
post
include
it on
that.
there.
Absolutely.
You got it.
You got it.
So I'm going to say something that is politically incorrect. I see people on the streets all the time, begging for money and stuff. And talking to somebody at the CARES campus, they said, you should not feed them. You should not give them money, because by encouraging them to stay in that spot and collect money and do whatever they're doing at night, they're not getting the services that are available to them. So they can get food at CARES campus, they can get help, they can find a bed. So we should actually be encouraging people to go to the CARES campus, and the same thing in Vegas. I mean, we've got similar situations there, where keeping them on the street is really not doing them any justice. Does that make sense to you?
It does, and so I so appreciate you bringing that up. We in this community have phenomenal resources. We have experts in this field, so please help get people to come and engage with those services. And not only that, I don't think a lot of people realize we have outreach teams going around this community engaging with some of those individuals. So I never want to stifle anybody's compassion and their willingness to give, but I would strongly encourage you to invest in this system that we have built here. This is more of a healthcare issue, and the level of professionalism that is required in this space is like never before. And so we have those team members over at the Nevada Cares campus, so please push them towards the Resource Center, towards our resources, so that we can connect them with where they need to go.
You need to have business cards we can hand out to these people. Here, go visit the Cares campus.
Yeah, love that.
So back to the sequential model. What Clara said is that she's trying to see Washoe County kind of lead the nation on this.
Yeah.
What is it about this model that is so exciting? I was supposed to have Judge Egan on to talk about this, but you get to sit in for the judge today as well as the sheriff. But it's the courts, it's the systems all working together, correct?
Yeah, I think what is so special about our approach in this region, and you should definitely talk to those two individuals, but I think a lot of times what happens is we operate in silos, but we're dealing with people, we're not dealing with widgets. And so getting rid of those silos is at the heart of this sequential intercept model. So the very fact that you're talking about Judge Walker, you're talking about the sheriff, you're talking about the district attorney's office, you're talking about housing and homeless services, we are now working across these silos. I, through my previous job, worked in different communities, and I've watched a lot of different approaches. The level of collaboration across silos is, in my opinion, unparalleled and unprecedented, and one of the reasons why I was so excited to take this job.
Oh, that's awesome. Because I know there was a New York Times article, I think, it was about how Reno is tackling homelessness, or Washoe County, and it really is an intercept model, but it's everybody working together, even the hospitals, even REMSA, because they're the ones that are picking them up going, what do we do with them? So it's all of that communication, and that whole, I remember the $1 Million Mike article that was a decade ago about how this same man kept going back to the hospital again and again and again and racked up about $1 million in bills. How do you stop that repeat behavior of mental health as well as addiction?
That's right. So I think, again, this person-focused, person-centered approach, and healthcare is grappling with this right now too. Are we following the person, or are we pushing the person into a particular silo? And so here we're following that person, so that, again, going back to your story, that you're finding the right solution for that particular person. And you're right, this is very expensive. I was in another community talking to the hospital system. Having just 2 of our unhoused neighbors come in for frostbite was going to cost them $350,000.
Wow.
Right? So it is very expensive to do nothing, not to mention the human toll that takes on those individuals.
All right, we're going to continue this conversation, but we'll be right back after this.
At Nevada Urban Indians in Reno, your health is our priority. Our medical clinic welcomes everyone. We accept all insurances, ensuring quality care is within reach. Nevada Urban Indians, your partners in health.
2025 is bringing big changes for Nevada businesses. If you have more than 5 employees and have been operating for 3 years or more, you must now comply with new state retirement plan mandates. The Vegas Chamber 401k plan makes it easy, offering a proven, customizable, and cost-effective plan for employers and employees to save with tax advantages. Visit vegaschamber.com to explore options and see how the Vegas Chamber can help you start saving for your future.
Sponsors are needed for the Greenhouse Project's annual Grateful Harvest Dinner, taking place Monday, September 21st at Nashville Social Club in Carson City. It's our biggest fundraiser of the year. For 17 years, the Greenhouse Project has provided agricultural education for students and fresh produce to our community's food insecure. Every dollar you give helps us continue this important, life-changing mission. Go to carsоncitygreenhouse.org to learn how you can help. Join us in growing a lasting legacy.
The winning is about to hit a whole nother level during the $100,000 March Mayhem giveaways at Tamarack Casino. Win up to $5,000 in cash every week and a top prize of $15,000 in cash during the grand finale drawing. Don't miss the mayhem. Your good times are at Tamarack Casino.
It happens. And when it does, there's UMC Quick Care.
This is Nevada Newsmakers.
Back on Nevada Newsmakers, I'm Randi Thompson, sitting in for Sam Shad, and I'm talking to Travis Sandefur, who's the new Director of Housing and Homeless Services at Washoe County. So we talked a little bit about this SIM model, and I know the courts have some diversion courts. They have a veterans court. I mean, so I won't stick you with talking about the court stuff, but what's really cool is to see the judicial system is addressing that not everybody needs to go to jail. Some people need to go to AA or NA. Some people just need to have mental health services. So it's a cooperative arrangement with everybody, but there's still gaps in the system, I'm assuming. So can you kind of talk about those gaps?
Yeah, absolutely. So there was a study that was done by the community or the corporate of supportive housing. And this showed that our region needs over 1,200 units of permanent supportive housing.
Wow.
Permanent supportive housing is a type of housing that is geared towards those with severe mental illness or those with the most complex physical needs. And so it's housing, but it's paired with supportive wraparound services, a lot of like what we've talked about throughout this. That's a huge number. Now we've added 50 of those units there on the CARES campus, a great pilot program. And these have tremendous results, but that's a huge gap in our system. And I think if we really want to see a drop in our long-term chronic homelessness, there's going to be a section of the population that just really, really needs that. Another one is you're starting to see an aging population. You know, nationally, you're starting to see between 40 and 50% of these individuals are over the age of 55. This is going to be a very different conversation. And a stat that I throw out there oftentimes is if you are unhoused, you have a 3.5 times higher mortality rate. It takes 20 years off your expected life. Wow. So if you are 55 and you're unhoused and you're in that system, it ages you.
Okay.
And so the complex physical challenges that come with that, the healthcare needs that come with that, we are running into a challenge of where you are not sick enough to be in the hospital. You should be in the hospital, but you're too sick to be in the shelter. And so there's this huge need for what's called medical respite, which is kind of that short-term medical assisted care for those who don't have shelter. So I consider those just some huge gaps. I could go on, but those are things we really want to focus on.
Well, you know, I think a lot of people are frustrated that they see these homeless out there and they know we're spending money. Yeah. We're spending so much money on homelessness, but we're also saving so much money in the sense of the burden it can put on our hospitals, which thus puts it on Medicare, Medicaid, which comes down to the taxpayers.
That's
so
right.
You're almost saving money by getting in there and intercepting these people and getting them on a pathway to healing.
Absolutely. It is so expensive to do nothing.
Yeah.
You think of the impact on your businesses, on your tourism, on the hospital systems. We live in interrelated, connected societies, and so not addressing these challenges, particularly around the mental health and the substance abuse disorder, if you're not addressing those things, it's going to be very costly. I think one of the challenges is that some of the savings of that, these are hard to show at moments, some are easier than others, but it is also a long arc of time. And we are about instant gratification. And so sometimes we don't see the results right away. I think I would add to that the shelter and those services are what I liken to the emergency room. Mm-hmm. You gotta have it. It does a really good job, but that doesn't solve heart disease. That doesn't solve cancer, right? And so we've got to keep going with these other pieces. The sequential intercept model, the things that the sheriff's office and the courts are doing is a part of that. Mm-hmm. The healthcare system, making sure that we're putting all of those other pieces in place, the permanent supportive housing, to make sure that we are in the long run saving this community money and doing what's best for the community and these individuals.
Well, I've seen a burden at, we have a business at a mall, and we had a man for about 2 days that just rampaged the mall. Mm. I mean, he took chairs from one restaurant, threw it through the window of Livingstone's church. Mm. He damaged some other windows. He broke apart some of the stuff that was out in front of some stores. So these 5 or 6 small businesses all had to go to their insurance company and get claims against one man who probably could have been called 911 and said, please come pick this guy up. Mm. But nobody really had the courage to do it. Mm. So it seems like we as a community need to be working more with our government and with you guys to say, hey, I see this person having an issue. How can you help?
Absolutely. Yeah, we want to be a part of that solution. We want to help you and the people of this community, operate more effectively.
Well, it's amazing what you're doing. How do you, I mean, you say you get up in the morning and you because you've got people that are so dedicated.
Yeah.
But is there a high burnout in this industry? I would think it's kind of tough to be in it for a long time if you don't see results.
Yeah. And we do see results.
Okay.
And I think that sometimes people don't hear about those. I have the most remarkable stories. These individuals, and it's sometimes it's a long pathway. It's an individual that it's over 5 or 6 years. But those are what we try to hold on to.
Mm-hmm.
But I'm amazed. I would think there would be higher burnout than there is. But I think I would also share, remember that these are your first responders. And so when we talk about the CARES campus, when we talk about the individuals who've committed to their life, you can beat me up, but please support them because they are getting up every day and doing some really hard and amazing work.
Oh, that's awesome. Well, thank you for doing this. Thank you. Welcome to the new job. Thank you for doing this on week 2 of your job. I appreciate it. And just God bless you in what you're doing. And we're going to be here to help you. And would love you to come back and kind of give us an update on after your first 6 months on the job.
Love it. Yeah.
All right.
Thank you so much.
Thanks, Travis. Appreciate it. We'll be right back after this.
Welcome to Story County, where history meets innovation, and a pioneering spirit continues to shape our future. At the heart of the Tahoe Reno Industrial Center, we power the future with global leaders in technology and manufacturing, driving progress that reaches far beyond our county lines. From advanced manufacturing to tech innovation, our industries are creating thousands of quality careers, fueling a vibrant economy that benefits every Nevadan. But it's more than just growth. Our community is our foundation, supporting families, empowering local initiatives, and creating a place where everyone belongs. Be part of a legacy built on bold ideas and boundless possibilities. Join us in building a brighter future right here in Story County. Story County, helping build Nevada's future.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
Each day, the Children's Advocacy Alliance partners with leaders, legislators, and families across Nevada to improve children's health, education, economic well-being, and safety. We recognize Nevada will be no better than the state of its children. Be a part of this change. Be a supporter of the Children's Advocacy Alliance. For more information, go to CAANV.org.
Well, thank you for watching and listening. You can watch us anytime at NevadaNewsmakers.com. Thanks again.